Hi, my name is Kanika. I'm a concussion physiotherapist at Move to Move. And this presentation is for any patients who are struggling with their concussion symptoms or any healthcare providers who are struggling with concussion management or not knowing who to refer to. So we'll talk a little bit about what concussion is, how to deal with it, and specifically how physiotherapy can help at our clinic. Okay. So what is a concussion? Concussion is a reversible neurological dysfunction caused by direct blow to the head or indirectly through forces transmitted to the head by the neck or elsewhere in the body. It's also known as a rapid movement of the brain inside the skull. So a little bit more to the definition here. It's a metabolical, physiological, and microstructural injury to the brain. It causes neuron disruption in the brain, often presenting as confusion and memory loss. It can result in chemical changes leading to headaches, dizziness, and mood changes. After the brain is in an energy crisis, demanding more energy than it can supply, making rest crucial. Only 10% of concussions result in a loss of consciousness, and it isn't required in order to be diagnosed as a concussion. Without proper care, concussion can lead to chronic headaches, memory issues, and emotional disturbances. This can be known as persistent post-concussion syndrome. Repeated concussions increase the risk of cognitive decline and neurodegenerative diseases. With the right management and rehab, most people recover fully. Tailored plans that include rest and the right form of movement are vital to recovery. So why do we care about this? Approximately 43 to 56% of people continue to be at a functional baseline, not to be at a functional baseline at 6 months. In the US, about 3.8 million concussions a year are not reported, which is about 50%. 58% of family medical residents only 58% of family medicine residents can accurately answer questions on concussion diagnosis and management. And about only 37% of family physicians, ER physicians, and nurse practitioners make appropriate return to play recommendations. So even though it's widespread, it goes largely misdiagnosed or not diagnosed, and a large proportion of healthcare providers are still not providing accurate management. So that was a lot of information. Let's try to explain that in simpler terms. So if you think of your brain as being the country of the US, and you think of neural pathways as being the Interstate I-90 connecting Seattle to Boston. Okay, so a concussion can present like a car accident or a traffic jam in the middle of the highway. The I-90 is a major highway. It's the fastest way to track from one place to the other. But with a concussion, an accident on the highway, it can lead to major traffic jams. It can lead to cars not getting to where they need to go at all, or being majorly delayed. Similar to how neural responses are majorly delayed or not getting where they need to go. So if you do have a concussion, what do you do? In all suspected cases of concussion, the person should stop the activity right away. Continuing increases the risk of more severe, longer lasting concussion symptoms, as well as increases the risk of other injury. This also means immediate break from work and school after 48 hours of rest. If there are no red flags, which we will discuss shortly, you can connect with a concussion first healthcare provider and resume gradual return to work. If you suspect a concussion or are displaying any signs, you want to make sure that you're providing yourself enough sleep during the first 48 hours and limiting your screen time, cognitive activity, staying hydrated, and consuming anti-inflammatory foods. And then once you're connected with a healthcare provider, they can provide you with further recommendations. So for the average individual, there is a concussion recognition tool that can provide you with some information on how to diagnose a concussion. So it's for non-medical people. You don't have to be a medical practitioner to be able to use this tool. Some of the red flags are on the slide below that would indicate a situation in which you want to call an ambulance. Okay, so some of the things listed here: neck pain, seizures, loss of vision, loss of consciousness, any weakness, numbness in the extremities, repeated vomiting, severe and increasing headaches, visible deformities. So if you're Googling CRT6 or concussion recognition tool on Google, you'll be able to download this tool and have it in order to be able to recognize if a person in front of you has a concussion or not. So what are some symptoms that they may present with? Loss of consciousness or responsiveness, lying motionless on the playing surface if you're on the field, falling from an unprotected surface, being disorientated, dazed, having seizures, slow to get up, unsteady on their feet, and any facial injuries. The other tool that we have available is the SCAT-5, or for pediatrics, the child SCAT-5. This one is only to be used by medical professionals. So if you are in the sports field, if you have a trainer or a physio on your team. Otherwise, if you're off the field and if you're in a clinic setting, it would be provided by a healthcare provider. Again, these can be Googled and downloaded for reference. We're just going to discuss a little bit more into common symptoms that you may have after the 48-hour period, or that practitioners may see when someone presents to their clinic. So there are different categories of symptoms. There can be physical symptoms, cognitive symptoms, sleep, and emotional. And I have listed the following symptoms under the categories there. Dizziness is one of the most common symptoms that will be present in over 50% of concussions, and is most strongly associated with a prolonged recovery, aka more than 3 weeks to recover. Loss of consciousness is not predictive of injury severity. A lot of people are under the impression that if you've lost your consciousness, it's going to take a longer time to recover, but currently the research does not indicate that. Life-threatening symptoms may not be present immediately, but may evolve over the first 4 to 6 hours. So if you do have a concussion, or if you know someone who does, you want to be able to monitor them for that first 4 to 6 hour period. And symptoms can appear right away, or they can be delayed, as we discussed. What is predictive of recovery is the prevalence of acute symptoms. So the more symptoms that you have and the higher intensity that they are, the more likely it is to have a longer recovery. And for females, it's extremely important where you are in your menstrual cycle. That can also indicate the length of recovery, as well as how intense the symptoms can be. Some psychological symptoms can also make you more prone to longer recovery from concussions, such as depression and anxiety, poor sleep, any history of ADHD, or multiple concussions. Those are some other factors that can cause prolonged recovery. Let's talk a little bit more about the recovery process. So we've already advised that the first 48 hours, you want to remove yourself from play, school, or work. Give yourself lots of rest. Try to limit your screen time, and eating anti-inflammatory foods. After that, so on the day 3 to 4 would be an ideal day to come in to see a clinician for an assessment. And you don't want to push through the symptoms that you're suffering from, okay? And if everything is presenting okay and your clinician is advising it, you can begin sub-symptom aerobic exercise. So what that means is light aerobic exercise, walking daily for about 20 minutes, including a 5-minute warm-up and a 5-minute cool down, as long as there's no symptoms being aggravated or worsened. If they are, then you're gonna have to back off the amount of aerobic exercise that you're doing. Pause, let them settle. And if they do settle within 90 seconds, then you can resume the activity. If they don't settle, then you want to stop the activity and discuss that with your provider. Day 4 to 7 with an average concussion recovery is when you start to gradually return to school and work. And that's also when perhaps you can do some exercise testing in your clinic. And that's when they can screen your body systems and look if there's anything else that needs to be addressed with your rehab. Day 10 is average recovery. Day 10 to 14 usually is average recovery of all symptoms if you're recovering from an acute concussion. The goal is for you to have 3 consecutive sessions of exercise with no symptoms before you start increasing the difficulty of the exercise. The graph that's presented on the slide here kind of demonstrates where you want to stop aggravating your symptoms. So with exercise, symptoms would appear around that bell that's shown on the graph. So if you've had a headache at a 1 out of 10 and you start going for a walk or a light bike ride and your symptoms increase to a 3 out of 10, that's okay. If they go past the 3 out of 10, you want to be stopping the exercise and discussing it with your provider. Because if you don't, then you hit up the fire sign, that flare. So when you're hitting that area of the curve, that's when you start to aggravate and you put yourself back a few days with recovery. If you stay at the bell or below with all your exercise, likely chances are you'll be able to continue with a normal recovery period. So what are the average healing timeframes? We've touched on this a little bit already. The average recovery is 10 to 14 days from a concussion. For youth or adolescents, they're younger, there's a lot more going on, there's some growth factors there. So we do accept a longer healing time frame, about 3 to 4 weeks. What it is important to recognize is that symptom resolution does not equal that the body is fully recovered. So even though you have no symptoms, that doesn't mean that you should be operating at 100% like you were prior to injury, which is why we recommend a gradual return to work, a gradual return to sport, activity, etc. Because if you're going back too fast, even if you feel okay, it may flare up symptoms a few weeks later. So this is sort of the average recovery for acute concussions. We're going to talk a little bit more about persistent post-concussion. So this is when people don't recover within that time frame and they're having symptoms for 3 months or longer, sometimes several years. So what is it? Let's define the term. Used to describe a constellation of non-specific symptoms that are linked to several possible causes. Cognitive deficits in attention or memory, and at least 3 of the following: fatigue, sleep disturbances, irritability, affective disturbances, so that's changes in mood, apathy, personality changes. Again, we're looking at that period of 3 months or longer before we categorize it as persistent concussion. The challenge is determining whether prolonged symptoms after concussion reflect prolonged version of the concussion pathophysiology or other processes like PTSD, cervical injury, or migraine headaches. So this is where your healthcare provider is going to have to distinguish between them. And sometimes you might have multiple healthcare providers on your concussion recovery team. Post-concussion syndrome is not just an injury. It's important to note that it's an event experienced by the patient and can take on different meanings and significances according to the circumstances. So not all persistent post-concussions are the same and not all of them present in the same way. This leads us to identifying concussion phenotypes. So the reason why we can't implement the cookie cutter approach to concussion rehab is because there is many types of concussions and many different symptoms that may be affected and body systems that may be affected, and they're not all presenting the same way. So in recent medical literature, they've identified the following phenotypes. So if you have a well-versed concussion healthcare provider. They're going to be screening all of these systems during their assessment and figuring out which systems need to be targeted with rehab. Okay, so you have your cardiovascular and autonomic phenotype. Most oftenly, this presents with lightheadedness, with positional changes or exertion, and an intolerance to exercise. And you have your vestibular phenotype, one of the most common phenotypes. You'll have trouble with balance and motion, dizziness, possible vertigo. Your next phenotype is ocular motor, which is the next most common. You'll find that people with ocular motor have trouble with visual tasks, reading and on screens, light sensitivity, difficulty comprehending while reading. Next one is cervical. Oftentimes people will present with pressure in the neck and spine, limited movement of the neck, headaches, dizziness, balance challenges. Cervical injuries can also mimic concussion symptoms. So headaches, difficulty reading, symptoms with exercise, all likely due to the movement of the head and the neck. We have your cognitive phenotype, which is next. Difficulties with long or complicated tasks, challenges with memory, attention, poor concentration, feeling sluggish, decreased processing speeds, and decreased reaction times. And then your last phenotype is your affective and mood. So constant worrying, anxiety, depression, irritability, sadness, fluctuating mood may have minimal findings on physical assessment. Depression and anxiety are common post regardless due to stressors surrounding the injury. And then the headaches, it's a bit debated within the literature if this is a phenotype or not, but we've listed it below. With the headache phenotype, you're trying to find the root cause of the headache, whether it's a migraine headache or a tension headache or a cervicogenic headache cluster, or whether it's just simply a post-concussion headache. Headache is a very common symptom within all the phenotypes, which is why it's a bit debatable whether it's a phenotype on its own or not. Now, any one patient can have one phenotype or several, and it's up to the healthcare provider to be able to identify which ones need to be targeted for rehab. And because of that, rehab can't look the same for any one patient. So now we're just going to discuss what we can provide at Move to Move with concussion rehab. So you can expect a detailed 1 to 2 part assessment with screening questionnaires and getting your full story. Oftentimes with a traditional acute concussion with a normal 2 to 3 week time frame, we only require a 1 part assessment, and we'll be able to kind of carry you through the next few weeks and make sure your recovery is going according to plan. Now, with a persistent post-concussion syndrome, especially if you've been struggling with it for months or years, there's a lot of different factors that we need to be assessing. There's a lot of body systems to check, and there's a lot of history to be gained from the patient. So that's where we have our 2-part assessment with a lot of questionnaires and trying to get your full story, because that's the only way that we can come up with a detailed plan that's tailored to you. So after we've gotten all our history and our assessment, we're going to go into our physical assessment screening for all the phenotypes. If you are in the post-concussion syndrome category, if you're in the acute category, we're going to just quickly screen through the most common phenotypes and make sure that we're not having any struggles with them. Okay, and then what you can expect from us as we take you through your rehab is we'll have collaborative work with other healthcare professionals. Oftentimes there are other team members that need to be on the team, like a psychologist, a dietitian, or an optometrist to take care of other symptoms. We're very well versed on recognizing that what we can help with as physiotherapists, and then what goes beyond our scope, where we need other healthcare providers as well. And with a lot of complex concussion rehab, oftentimes you do need a team of multiple members, and it's not just one therapist dealing with you. And then what we do offer is regular 45-minute follow-ups with you, specifically tailored to your plans. Gives us enough time to touch base, go through your program, have you practice it in the clinic, and feel confident about carrying it through it. Great. Well, that's just a little bit about what we do, and we've kind of gone through the two different types of concussions and how they present. So if you feel like you require therapy from us, give us a call and let our front desk staff book you in. And if you're a healthcare provider who's struggling with management, or you think that physiotherapy may be beneficial to your patient, make sure to refer them on to us. Thank you.